channel. So today we are going to go through liver cirrhosis. So in terms of definitions, liver cirrhosis can be defined as a chronic and progressive disease which is characterized by widespread fibrosis or scarring and also nodule formation. That's the definition. Or you can also define it as a consequence of liver disease characterized by replacement of liver tissue by fibrous scar tissue and regenerative nodules leading to loss of liver function. That's the definition. Then types of liver cirrhosis, we can have alcoholic cirrhosis, which is most common and due to chronic alcoholism. Scar tissue characteristically surrounds the portal area and it is micronodular. Okay, then we can have a post-necrotic cirrhosis, which are broad bands of scar tissue due to late results of acute viral hepatitis, post-intoxication with industrial chemicals, and it is macronodular. Okay, and then we have biliary cirrhosis, which is where scarring occurs around the bile duct in the liver and results from chronic biliary obstruction. Okay, then we can have a cardiac cirrhosis, which is associated with severe right-sided long-term heart failure, and it is fairly rare. Okay, these are the types of liver cirrhosis. Then risk factors can have a regular moderate alcohol consumption, age more than 50 years, male gender. Okay, then chronic hepatitis C and B infection, obesity, which is due to hepatic steatosis, malnutrition, chronic impairment of bowel excretion. Those are the causes. Those are the risk factors. Then in terms of causes, the causes, we can have alcohol abuse. If someone is now abusing alcohol, that's will now become a cause. Non-alcoholic fat liver disease, that's a cause. Chronic, now long-term viral infection of the liver, hepatitis B, C, or D. Then alpha-1 antitrypsin deficiency, cystic fibrosis, genetic diseases. You can also have hemochromatosis and Wilson's disease. Then we can have autoimmune hepatitis. We can have bad Chiari syndrome and also chronic cardiac failure. Okay, then you can also have drugs and toxins. You can have schistosomiasis. It can also be cryptogenic, or you can have drugs which include amiodarone, methotrexate, sodium valproate. Okay, so these are some of the causes of liver cirrhosis. Then for the pathophysiology, it's a brief pathophysiology which we are going to go through. So just depending on the primary injury to the hepatocellular element, there is going to result in or initiate an inflammatory response where the cytokines are released and which will lead to release of also toxin substances. Then this process and liver cell damage altogether result in hepatomegaly. So usually someone starts with hepatomegaly. Okay, then the toxins which are produced from the cytokine released causes destruction of hepatocytes, bile duct, and vesicular endothelial cells. And since the liver has a generative ability, so those attempts at repair through cellular proliferation and regeneration eventually result to fibrosis and a small nodular liver. In short, there will be formation of fibrous scars. Okay, especially if the injury is not removed or if the injury is not treated. So the hepatic function is slowly impaired, especially if the injury is not treated. Then there will be obstruction of venous channels which block hepatic blood flow and cause portal hypertension. That's the brief pathophysiology. Okay, Then in terms of stages of liver disease, so stages, we can have a normal liver that results in a fat liver where there is depositions of fat which causes liver enlargement. So this is supposed to be liver enlargement. Sorry. Okay. So liver enlargement. Then there will be liver fibrosis. Scar tissue forms. The scar tissue is going to form, and there will be more liver cell injury that's going to occur when the injury is not treated. Then after that, then it will lead to cirrhosis now, where the scar tissue makes the liver hard and loses its function. That's the stages of liver pathology. Then we can have clinical manifestations. So clinical manifestations are classified per system. So neurological symptoms, we can have hepatic encephalopathy, we can have peripheral neuropathy, we can have ascites, which are just flapping tremors, and these are asynchronous flapping motions of dog's flexed hands occurs in hepatic encephalopathy. Then under cardiovascular manifestations, we can have fluid retention, we can have peripheral edema, we can have ascites, which is accumulated fluid in the abdominal cavity, detected when the fluid is more than or equal to 1.5, and it is caused by portal hypertension. Then under gastrointestinal tract manifestations, you can have anorexia, dyspepsia, nausea, vomiting, change in bowel habits. Then there can also be a dull abdominal pain, gastritis, hematemesis. Then there will be fetal hepatitis, which is the breath of the dead, which is a strong and musty smell due to trouble filtering sulfur. So we call it a fetal hepatitis. Okay, then there will be esophageal and gastric varices, also due to increased portal hypertension. Then there will be hemorrhoidal varices. Okay, so those are under gastrointestinal tract. Then for the reproductive, we can have amenorrhea in younger women and vaginal bleeding in older women. Then testicular atrophy, we can have gynecomastia, which is benign proliferation of glandular male breast tissue beneath the areola and is due to enhanced conversion of androstenedione to estrone and estradiol. So estrone and estradiol are naturally occurring estrogen. So this is one way the benign proliferation of glandular male breast tissue occurs beneath the areola occurs. So it could be that the enhanced conversion of androgens to estrone or estradiol, which are naturally occurring estrogens. Then the other reason could be due to reduced estradiol degradation in the liver. So when the liver is one which is responsible for degradation of estrogen, so that in the male body there shouldn't be a lot of estrogen as compared to the testosterone. So if there is reduced estrogen degradation in the liver, then the estrogen level is going to go up, which will start stimulating the glandular male breast tissue beneath the areola, hence causing the gynecomastia in men. Then the other could be impotence with loss of libido, which is sexual desire. Then there will be loss of axillary and pubic hair. So those are some of the things you have to know under reproductive. Then in the integumentary system, so as you can see, we are putting diagrams to help you remember which system we are talking about. Okay, then you can have jaundice, hepatic, pulmonary edema, you can have spider angiomata, which are central arteries with tiny vessels, and they are found above the nipple, mainly on the trunk and face, and are due to raised estradiol or decreased estradiol degradation in the liver, also known as spider nevus or spider nevi. Okay, then we can have caput medusa, which are just large, visible, distended, engorged paraumbilical veins due to severe portal hypertension. So those are some of the things. And lastly, we can have papilla, which are just blood spots or skin hemorrhages, and purple usually are purple spots. They are more like purple spots due to low platelets. So this is under integumentary system. Then under metabolic system, we can have hypokalemia, hyponatremia, and hypoalbuminemia. Okay. Then under hematologic system, we can have anemia, we can have thrombocytopenia, we can have leukopenia, we can have coagulation disorders. Then those are the clinical manifestation under each system. Then other features we can have on others is it may be asymptomatic altogether. They can even be found maybe when just someone comes maybe for a scan, they find that they have an enlarged liver or something. Okay. Then splenomegaly, which results from portal hypertension, blood accumulates in the spleen. Then you can have varicose bleeding, which is nodular liver. You can have varicose bleeding. The other is nodular liver, weight loss, muscle wasting. It can also lead to type 2 diabetes. You can also have debut contractures. Then you can have spontaneous bacterial peritonitis, which is also a common complication when the liver cirrhosis is usually not treated in advance, when usually not treated adequately or in the early stages. Then you can also have leukonychia, which is just white nails caused by hypoalbuminemia. Then you can have hypertrophic osteoarthropathy, which is just finger clubbing or acropathy. So finger clubbing is hypertrophic osteoarthropathy is finger clubbing grade 5, and it is caused by hypoxemia, which develops following the right to left shunting of blood or pulmonary hypertension. Then diagnostic evaluation. So what are some of the diagnostic things you're going to do? So of course history collection is very important. Then the next is physical examination, and we can also have other investigations such as the liver function tests, where we have albumin, which is decreased in advanced liver cirrhosis, and the levels decrease as a result of reduced hepatic production. So it's supposed to be hepatic, okay, and hepatitis. So there will be reduced hepatic production of albumin, and there will be sequestration. Then the other reason is that it can also decrease due to sequestration into the ascites and interstitium. Then you can also have a prothrombin time that is prolonged in advanced liver cirrhosis due to reduced synthesis of vitamin K dependent clotting factors, which are factor 2, factor 7, factor 9, and factor 10. So how to remember is 1972, but just know that the one is for 10, the 9, 7, 2. So these are the factors that are vitamin K dependent. So 1972, but just bear in mind that the one is differentiated for 1 is for 10. So 1972, that's the way to remember the vitamin K dependent factors. Okay, then the other test we can do is on the liver enzymes. On the 7 liver function test, the liver enzymes are going to be elevated. So the transaminase, such as aspartate transaminase, which is AST, then alanine aminotransferase, which is ALT, are going to be elevated, but the AST to ALT ratio is usually 2 or more, especially in alcoholic cirrhosis. Then the raised levels are due to their leakage from damaged hepatocytes. Then often normal or moderately raised. Okay, so this is the liver function. These are liver enzymes. So you do a liver enzymes test. Then apart from transaminase, then you can also have alkaline phosphatase, which is ALP, which rises due to cholestasis, increased by less than threefold the upper limit of normal. Then higher levels of ALP are seen in primary biliary cirrhosis and primary sclerosing cholangitis. So this is for ALP. Then the other enzyme we can do, so we have done these enzymes, and now we are doing this enzyme, which is gamma glutamyl transpeptidase. So gamma glutamyl transpeptidase, which is more specific for liver injury than ALP, and rises due to cholestasis. Higher concentrations are seen in active alcoholics. Okay. Then the other diagnostic evaluations is serum bilirubin, which is raised. Then liver ultrasound to assess the severity of cirrhosis. It also shows liver nodules in the liver and decreased echogenicity and reduced liver size, which is there will be hepatic atrophy, especially after the stage 4 hepatomegaly. Then if the function again continues to reduce, then it will again just start to reduce in size. Okay, so there will be hepatic atrophy. Then the other you can do is Doppler ultrasound, which will show us portal hypertension. Then you can also do CT scan, MRI, which is you can also do it either helical or conventional. Then liver biopsy is the gold standard diagnosis of is the gold standard investigation for diagnosis of cirrhosis. Then you can do full blood counts as DC, you can do U&Ds, you can do esophagogastroduodenoscopy. Then you can also do paracentesis to examine acidic fluid for cell, protein, and bacterial counts. Okay. Then you can also do a percutaneous transhepatic cholangiography, which is a PTC. So these are the diagnostic evaluation. So we have exhausted a lot. Now let's talk about the complications of liver cirrhosis. So complications, you can have ascites, hepatic encephalopathy, esophageal varices, hyponatremia and water retention. You can have spontaneous bacterial peritonitis. You can also have jaundice. So those are some of the complications of liver cirrhosis, but these are not the only ones. Okay, like we talked about in the clinical manifestation, there were those big clinical features. Those were also part of the complications. Then in terms of treatment of liver cirrhosis, so the goals is that you have to prevent further damage to the liver, where you treat the underlying cause. So if it's alcoholic cirrhosis caused by alcohol abuse, it's usually treated by abstaining from alcohol. Then that's if it's usually in those stages where it's not in the fibrous carrying stage. But even though it's in the same stage and it's caused by alcohol, still you abstain from alcohol. That's the treatment. Then also treatment for hepatitis related cirrhosis. It involves medications to treat the different types of hepatitis. For example, an example of a medication is Truvad. But like we said, so it involves medications used to treat different types of hepatitis. Just an example. Then if the cirrhosis is caused by Wilson's disease, in which copper builds up in organs and is treated with a cheration therapy, for example, penicillamine, to remove the copper. So we do a cheration therapy. Then the other goal is to treat the complications of cirrhosis. If someone has ascites, what are you going to do? If someone has hepatic encephalopathy, what are you going to do? Then the other goal is to prevent liver cancer or detecting it early. And lastly, we do liver transplant, which is the ultimate treatment for cirrhosis and then stage liver disease. And then I also wanted to share something, which is a liver. There is a practice of using LIV52. So I wanted to share what LIV52 is and what is the data on the current Medscape article. So LIV52 was said to be is an Ayurvedic hepatoproductive agent and is not useful in the management of alcohol-induced liver disease. And standardization of herbal medicines has been a problem, and prospective randomized placebo-controlled clinical trials are lacking to support their efficacy. So it's an herbal medication, though most people, since it's usually produced in form of tablets, People usually use it because of the fact that people who have also seen people on level 52, they have stopped taking alcohol, or maybe it was caused by hepatitis, they have taken Truvada and other medication, they start getting better. So that's why there's that continuous use of it. But scientifically, the clinical trials are lacking to support their efficacy. Then the methodological qualities of clinical cares of treatment with able preparations are poor. So the efficacy of these able preparations need to be evaluated in rigorous, designated, large randomized, and double-blind, placebo controlled multi-center trials. That's what I wanted to share about level 52. So that's level 52. Then the other thing is, which is transjugular intrahepatic portosystemic shunt. So before maybe you do your definitive, which is your liver transplant. If that can't be managed, you use the transjugular intrahepatic portosystemic shunt, which is TIPS. So what is TIPS? So TIPS, this is where you use a shunt, as you can see here. So this is a shunt that is connecting the portal vein to the hepatic vein. Okay. Then also in the other picture as well, as you can see, there's a shunt connecting the portal vein to the hepatic vein. Okay, so it relieves high blood pressure in the portal vein, so it relieves portal hypertension. So if someone has esophageal varices and other complications of portal hypertension, they will actually be relieved from the high blood pressure. It is minimally invasive and uses imaging guidance to connect the portal vein to the hepatic vein. So that's what I wanted to share on the transjugular intrahepatic portosystemic shunt. Okay, I think we can end here for today. Then the other things is that you have to also check out other videos on the channel, and please subscribe and hit the bell notification. Okay, see you on the next topic. Thank you for your attention once again.